Hi, I'm Mr. Gurjar. I'm a consultant colorectal and general surgeon here at Hatfield Hospital. So hernia is extremely common. They occur when there is a weakness in the abdominal wall, and that allows a part of the body from within to push out through this weakness and therefore present as a lump. Often they can be pushed in and they may disappear when lying down, although when you strain or cough, the lump can reappear. The lump may simply contain fatty tissue, or it may represent a loop of bowel which is pushed through the weakened abdominal wall. This can be a really serious problem if left untreated. The commonest type of hernias are groin hernias, which can be either inguinal hernias or femoral hernias. The second commonest are incisional hernias, and this is caused by previous abdominal surgery. Hernias can affect anybody and are extremely common. They're most commonly seen in adults, especially men, who can develop a hernia with age, and this is because there is a natural weakness in the abdominal wall in men. Hernias are also seen in active individuals who do strenuous sports, such as weightlifting. Women can also suffer from groin hernias, although they're more likely to get femoral hernias than inguinal hernias. The symptoms associated with a hernia are very variable, and it depends on their size and location, as well as the contents of the hernial sac. Typically, you would notice a lump that might increase in size during the course of the day. There may be an associated ache or discomfort. In an acute incident, if bowel was involved and was caught in the hernial sac, you may experience nausea and vomiting and serious abdominal pain. If these more significant symptoms were present, they could give rise to the need for emergency surgery for the hernia, so it's important to seek a prompt diagnosis from a specialist hernia surgeon. I would suggest that any symptoms of a painful lump associated with nausea or vomiting and sudden absolute constipation would all suggest the need for an urgent medical review. The vast majority of hernias can be diagnosed by a good physical examination. An experienced surgeon will be able to determine the type of abdominal wall hernia by carefully palpating the defect and its location in relation to key landmarks. Sometimes we use an ultrasound scan or a CT scan to confirm the exact nature of the hernia. After diagnosis, a surgeon will offer advice about the need for surgery. The appropriateness of surgery is dependent on the type of hernia and the contents of the hernial sac. It's also important to establish the severity of symptoms of pain experienced by the patient and the impact on their day-to-day living. We'd have to take into account their general background health, which would allow us to determine whether or not surgery is appropriate and relevant. The treatment for a hernia is really dependent on the needs of the patient. We do use several options, which include an open operation where a cut is made into the skin to allow the surgeon to access and push the hernia back into position and then repair the defect using a piece of reinforcing synthetic mesh. Nowadays, a laparoscopic approach is preferred where possible. With much larger complex hernias, such as incisional hernias, these may require advanced abdominal wall reconstruction techniques, which may use a combination of bridging mesh or biological mesh and use anterior or posterior release techniques to help reduce the size of the defect. These are much more complex and usually require a longer inpatient stay. Typically following uncomplicated surgery, a patient may be able to go home within 24 hours. My advice is always that they should avoid any form of lifting for at least 6 to 8 weeks after the operation. Recovery is much quicker with the keyhole techniques. Hernias can and do recur. The most important advice that I give to all patients is to respect the 6 to 8 week period post-surgery and avoid all form of lifting. This allows adequate healing of the tissues and minimises the chance of recurrence. Having said that, any hernia has a propensity to recur, and we give hernia repairs a life of between 8 to 10 years. I accept direct referrals to One Hatfield Hospital or via the GP referral service.